Following program are pre-recorded Talk of the Town on Super Talk 1270.
Super Talk 1270, your team to Talk of the Town. I'm Steve Michael, along with Kevin Oberleiter, Dakota Health, Dakota Pharmacy, downtown Bismarck Corner Drugstore. And all right, we're getting into that time of the year when it's cold out, it's winter, bad habits start popping up.
Holidays are upon us.
And shoveling and
So I was
eating too much, getting sedentary.
Trying to come up with a subject for this week, and towards the end of last week, I heard a patient out front talk about, it's really time that we start aggressively washing our hands more, and because of the cold and flu season. And
it seems like right now around the Bismarck Mandan, everybody's sick.
Yeah.
Everybody's got, my wife's got teacher immunity. She's been sick.
Yeah.
And she never gets sick. I'm like, you get me sick, you're in trouble.
Yeah.
I'm like, if it's COVID, I'll go lick you because I get a really good immune system. All right, let's go. But that's part of it. The hygiene's part of it. Proper practices, not getting out of good habits and sliding into old habits.
Right.
It's all about health care for winter.
So let's expand the idea that we have to do better job of hygiene, washing our hands more often, and expand it to other areas. So I started to investigate hygiene.
Proper hygiene.
Proper hygiene. There's all sorts of hygiene theories. And in our practice, when somebody comes in with reflux, and we'll concentrate on that in a bit, we talk about eating hygiene. How do you eat? When do you eat? Sleep hygiene. There's things that you should do that are more hygienic that you do on a regular basis. So if we're going to wash our hands on a regular basis, what other hygiene tips can we offer? Now, as in
my case right now with Wendy being sick, I'm sleeping in the spare bedroom.
Well, that's immunity hygiene.
That's immunity hygiene.
Yeah. So, and it's not anything different than we've ever talked about. I think it's just a little bit different way to look at it, because our mindset does change when we get into the cold and flu season, and we try to avoid people that are coughing, and we try to wash our hands more often. We try to separate ourselves, just like you. When our spouse is sick, we try to create
But here's
some
the
distance.
other thing. This is why the hand washing and the other, whether it's oral hygiene, nasal hygiene, hand washing hygiene, all of that comes into play because we're living in a petri dish.
Yeah.
And you can do all that stuff, but you're still exposed. So I know washing my hands or even sleeping in the spare bedroom because I don't want to smell the Vicks. But all of that, we're still in the same house.
Yeah.
The air handling system, all of this is getting recycled. And we have to have proper immunity ourselves. And all of that only goes so far. Because, again, I'm breathing the same air she is. I can be in a different room, but I'm still breathing the same air.
But that's why we have to practice things like immunity hygiene. What can we do to support our immune system so they're strong? There's also something that I ran across that I really wasn't aware of. I mean, I was aware of the theory, but there's been some work done on something called hygiene hypothesis. And hygiene hypothesis is the idea that, are we too clean? Do we not expose ourselves to things that can be detrimental, and our body loses the ability to defend itself against that?
I'm a firm believer in the fact that as a child, I drank from the garden hose and ate dirt.
Yeah.
So
exactly.
Really good immunity.
Yeah.
And a lot of kids nowadays are shielded from, what we call being kids.
Yep. So I got to know a physician.
Like you fall on your bike and you scrape your leg, rub some dirt in it. You're fine. Just go be tough.
There's
something to be said about that.
This was 15, 20 years ago. I got to know a physician in town who's been long retired, and he used to just bemoan the idea that we wash our hands all the time. He's like, no, we need that exposure.
I hate hand sanitizer. I won't do hand sanitizer because I can't stand the smell.
We need to put our fingers up to our nose, and there's germs on there, so we're exposed to those germs. And he's like, part of our immunity problems is we're too clean.
Yeah.
And at the time, I thought, well, this guy's really off his rocker.
Well, think about.
But in reality, he was ahead of his time.
What'd your parents do when one of your friends in the neighborhood got measles or chicken pox? Play date.
You went to visit.
Yeah. Because you were building that immunity for later.
Yeah. I just think that this hygiene hypothesis is very interesting. Now, I think you can take it too far.
Yeah.
During COVID, we were reading stories about kids having COVID parties. So if somebody had COVID, they'd all get together.
Yeah, well, it wasn't the chicken pox or measles mentality.
Yeah.
That was a wrong application of that.
Right. And then, of course, the masking controversy is, we decrease the exposure to the virus, so our natural immunity against it didn't develop like it normally would. That's still very controversial, but I think if you read the theories of hygiene hypothesis, I think there's something to that idea. So take a look at a vaccination. Yeah.
So a vaccine, it's a little bit of that illness, whatever it may be, in to expose your body to it.
Yep.
And I am a firm believer that while those have a place, natural exposure, because things in nature tend to be better, I think there's a big case to be made for natural exposure to things and being exposed to something in a natural setting rather than an artificial setting.
Yeah, there's a medical science called homeopathy, and sometimes homeopathy gets thrown around randomly in the whole natural medicine world, but homeopathy is a specific science developed in the 1600s. And the theory behind homeopathy is likes cures likes. So Dr. Hahnemann, who's the father of homeopathy, he actually he'd infect himself with diseases and then treat himself with tiny doses of the disease to see if his own immune function. He ended up in an institution because he gave himself malaria on purpose. And of course, they thought he was a crazy person. But his idea was then small exposure to malaria after having the disease stimulates your immune system to fight against it. And that's really what, if you think about a vaccine, it's a very, very small dose. It stimulates your immune system to fight off. So it puts the army sitting at chairs at the border. So when they're exposed to that problem that the vaccine is treating, the army stands up because it's there.
But it takes time to build up those forces.
Right. And I think the forces are much stronger if it's a more natural exposure. So the more I read about hygiene hypothesis, the more I think that there's really something to it. But there's all sorts of hygienes that we'll discuss. Eating hygiene, sleeping hygiene, mental health hygiene. They're just all things. I think we just take a different look at them that they become. So washing our hands is part of our natural day. Everything that's in these hygiene categories should be part of our natural day.
We're talking to Kevin Oberlander, Dakota Health, Dakota Pharmacy, downtown Bismarck's Corner Drugstore, talking about hygiene today on Super Talk 1270.
Talk of the Town, brought to you by Big Boy. Just get in line. It moves fast. Trademark Realty and Silver Ranch. Talk of the Town. Super Talk. Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bach along with Kevin Oberlander, Dakota Natural Health Center and Dakota Pharmacy, downtown Bismarck's Corner Drugstore. We're talking about immunity, hygiene, and things you need to prepare for a long, long winter.
Well,
we've had a really good fall.
Yeah, we did.
I'm not going to complain, but no. I got a feeling we're just going to get hammered.
It's very possible. And we may not get a lot of snow, but it's going to be cold.
It's going to be cold.
Yep.
I wish it was the other way around.
Yeah. I
like the snow. I just don't like the cold.
Yeah, I don't like shovels. I don't like shovel snow when it's 10 below. Yeah. So hygiene.
Did you book that Allegiant flight yet?
Yeah. So hygiene. What hand washing hygiene? It's a
lot of different types of hygiene.
Pretty basic. Wash your hands for 20 seconds after you use the restroom, after you cough or sneeze. Pretty basic.
God, I remember all those years I was like going through pre-med and stuff. It's like, and I got in this really weird habit of everything was a surgical scrub.
Oh, yeah. Oh, yeah.
I'm like, all right. Elbow with it was weird. That was my habit because that was the routine. You just started doing it.
So one of my favorite stories, I was at one of my first natural health seminars, and Dr. Hintz, who's since passed away, so I can tell the story, during a break we were in the restroom, and after we were done, a bunch of us were standing at the sinks washing our hands, and Dr. Hintz left the urinal and walked out the door. And as we're walking out, somebody says, I can't believe he didn't wash his hands. And he overheard it, and he was a great guy. He turns around and he goes, my mom taught me not to pee on my hands. And it was like, okay.
Well,
but
he was right.
He was kind of of that hygiene hypothesis. It was, we need some natural immunity exposure. One of the hygienes, I think, that we don't really think about it, because hopefully it's part of our daily routine, is flossing and brushing and, rinsing our mouth out. Oral hygiene is really, really important, because there's so many bacteria in our mouth, and our mouth is an incubator, and these bacteria grow and they form biofilm.
I don't carry a toothbrush with my wife does, but I don't carry a toothbrush with me all the time. So it's like you go to lunch and stuff, and it's like get home and I brush my teeth. But gee, I have these really cool lozenges that I carry with me all the time now, and I've noticed the difference.
Oh,
it's huge.
They're amazing. A pharmacist friend of mine was in yesterday. His dad had some implants put in, and he's like, any ideas on what I can do to help him? Because now he has to wait a certain time till the bone strengthens, and it was right to the Advanced Gum Health lozenges, because you take away the bacteria in the mouth that weaken the bone. And I had a PerioProtect customer from Oregon call me. She had an implant failure, and they had to redo another. Oh, no.
Fun.
So they had to redo it and another one. And she was wondering, I'm doing my PerioProtect trays. What else can I do? And I said, I think you should do these lozenges. And she called me last Thursday to order some more, and to tell me that she had her follow-up on her latest procedure, and her dentist was, Mary, what are you doing different? Your implants both look great. And I was worried that you're just one of these people whose implants might fail. And she had her lozenges in her purse, and she goes, I'm using this. And he goes, can I take some pictures? Can I document this? And I need to know where you got those. So we now have some tools in our toolbox that help us. So we don't carry a toothbrush. We're not going to floss after every meal, which we should, because food gets impacted in our periodontal space, but we don't.
I get yelled at by my dentist for not flossing enough. Now my pharmacist is yelling at me too.
Yes. But there's some options. So
there are.
During this time of year when these bacteria are invading our body through our mouth, I think it's and they're super easy to do. They're called Advanced Gum Health. So stop by and check them out.
Yeah, you really should, because I tell you what, I have noticed such a huge difference since they started utilizing those.
Yeah.
And it's cool because it's what the astronauts use.
It is. And they also have a pet formula.
And you gave me a sample of that, and what a night and day because we've got one older dog, and I've always done a really good job of scaling my dog's teeth, but the frequency now, her bad breath, it's night and day. It is night and day.
So the product is being used in zoos, so large cats, primates, they're actually using it to lessen the amount of times that they have to
put them out
to clean their teeth, because it's really, really hard on them. So super products.
My dogs let me scale their teeth, but I couldn't imagine trying to walk into a tiger cage. They're probably not going to do that.
No. And we give our pets like these green chewables to clean their teeth.
Yeah.
And really, if you talk to the experts in that field, we're driving those bacteria deeper when we're doing that. We may be cosmetically, they're looking better because we're knocking some of that off, but some of that we're driving it deeper into their gum line, so it actually can make their gum disease worse. So oral care, I think, is really, really important. But there's food hygiene, there's respiratory hygiene, there's wound care hygiene. We talk a lot about, and we'll probably bring these up in the next session because they're big items. We talk a lot about sleep hygiene and eating hygiene, and not only for this time of year, but all the time, because we get lots and lots of questions about insomnia and lots of questions about reflux. So we've talked about eating and sleeping hygiene with our population of patients for a long period of time. And it's also one of the things that really sparked my interest in looking deeper into other areas of hygiene, which is what we're doing today.
Okay, the interesting part you just said there was the reflux side of that.
Yeah.
And so many people deal with acid reflux now, and take a pill.
It's all over.
Take a pill. Yeah, just take a pill.
Yep.
And now they're finding some of those pills are having other long-term health effects with memory and cognitive skills, and any opportunity to get off of those is probably a good idea, but you don't think necessarily of it being associated with hygiene.
Yeah,
that's
there's as you'll see in our next segment, there's something that we talk about eating hygiene. I had a gal in yesterday with bad reflux, and her physician suggested that she try to either wean off of it or reduce her usage because her bone density was starting to show some problems. And with these medications and the decrease of stomach acid, we lose the ability to ionize our minerals, which then are not absorbed into our system as efficiently, which can be hard on tissues and predominantly bones. If we're not getting calcium and magnesium in our diet or from a supplement, and we don't get it into our blood system because of our digestive disability, which is brought on sometimes by the medication. We are seeing more and more referrals from the physician prescriber population that they're concerned about the medication's long-term use. Now, there's a danger in reflux because of the esophageal erosion, and some people just can't go without them. So we talk a lot about eating hygiene.
We'll get into that after the break, the eating hygiene part. We're talking about hygiene with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore on Super Talk 1270.
News, talk, and sports for Bismarck Mandan. Super Talk 1270. Welcome back to Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bachman with Kevin Oberlander, Dakota Natural Health Center, Dakota Pharmacy, downtown Bismarck's Corner Drugstore. We're talking about hygiene as we're getting into what equates to cold and flu season, winter, all that stuff.
Yeah.
We're talking about acid reflux going into the break and being on a lot of those medications long term, and I was on them for a long time for some acid reflux. And I noticed the difference and got off them and haven't had an issue. But a lot of people,
good for you.
Yeah. Well, I wound up doing some fasting and changed the diet a little bit, lost a few pounds, went, okay, my opportunity to get off these. And I was on them for a long time because that's what I was prescribed for, some acid reflux. And it was at the point where I actually, if I missed a pill in the morning, I noticed it.
Sure.
I noticed that, okay, I need the pill. And
the patient yesterday said she went one day without her generic Prilosec, a prescription medication that she had been prescribed, and she was fine. 2 days, and she had terrible reflux. And that's when her physician said, we need to work on this. So my recommendations were, well, first of all, wean off of it. Don't stop 2 days in a row. Maybe stop 2 days a week and see how you do. But then I gave her some of the tips. And one of the things we talked about was eating hygiene. And this first came to my mind. I was at a compounding pharmacy lecture. It's been quite a few years ago, and a gastroenterologist was one of our guest speakers, and he was actually talking about compounding a particular steroid that could be ingested for lower bowel functions, but he really got off track, and he started talking about probiotics and his theories on probiotics and how he never believed in them until he started to see a population of his patients. So here's here's a surgeon who was doing bowel resection, gastric bypass, all sorts of invasive gastrointestinal surgeries. And he said, I started to see a population of people that they seemed healthier and they just seemed to heal up better. So I dug into it deeper and I started to document the habits of these patients. And the one common denominator is they were taking probiotics. I never believed in them. I thought it was a charlatan thing. He actually went to France to study probiotics. France is the innovators in some probiotics, and especially Saccharomyces boulardii. And he said that today I will not do surgery on a patient until I've had them on a regimen of probiotics for a period of time. Now, you can go to our website. I have a blog on probiotics, and I talk about that and his theories about how to properly take probiotics, rotating them, making sure your population's diverse, not taking the same formula all the time, which I run into all the time.
That's what a lot of people, well, I tried this, it worked, I'm comfortable with that. They don't change it up a little bit.
Right.
You need variety.
You need diversity.
Yep.
Yes.
You just, like, I cook for our dogs and they're healthier because they're not just eating kibble.
Right.
Just like you and I'm not going to eat the same thing every day for the rest of my life.
Right.
Well, I could eat steak, but you have to have diversity, some variety in your diet makes you healthier.
Yes.
Same thing with probiotics.
Yep. And I gained a real trust in what he was talking about just because we were into probiotics already. So just his theories and his ideas, I was like, oh, this guy's thinking outside the box, and I really like his message. And it's the first time I ever heard the term eating hygiene. He was adamant about teaching his patients how to eat. And he had some really, really cool theories that I use to this day. And again, this guy studied this stuff like crazy. He found that people who cook or chefs tend to have less reflux because they're over their food and they're exposed to the odors and the smells. So their salivary production is predominantly greater than somebody that just sits down and starts to eat. He said he tells his patients, when you sit down to eat, I want you to spend 3 to 5 minutes with your head over your food, absorbing the odors and the smells to stimulate salivary production. Because we tend to eat too fast. We don't let saliva do its job, and saliva is critically important to the start of digestion. And the whole idea, he said, the whole idea of chew your food is true. So if you have somebody with reflux, tell them how important it is to chew their food.
20 bites.
20 bites. My family doesn't like to go out to meals with me because I take so long to eat, because I really adhere to the idea that you need to eat slow.
But there's something to be said about that too. You used to sit down at a meal and everybody's at the table and it's a family and you take your time and you're having conversations, take a couple bites, you're visiting, how's the day? Lifestyle, we've gotten away from that.
We stand and eat.
We are so fast paced. It's like
we eat on the job. We eat running, and it just doesn't work.
Thanksgiving dinner. It's like scarf the food down so I can go get into the food coma watching a football game.
Exactly.
It's like enjoy the family time. Just sit down, relax. And I do a lot of the cooking for our household, so I know exactly the difference, because by the time dinner rolls around, I've been probably snacking for a while. So, but I notice the difference, be me cooking rather than going to somebody else's house.
Yep.
And okay, dinner's ready, go eat.
Yep. So the other idea that I thought was pretty interesting from this guy was the idea that we should not drink fluids while we eat, because we tend to chase our food with whatever, milk,
I'm
water.
horrible that way.
Yeah, we don't chew it, so we chase it. And that's how we were raised. He teaches his patients to not drink anything or minimal fluids, because the fluids digest your stomach acid. And if you digest your stomach acid, the sphincter mechanisms at the top and the bottom of the stomach don't work properly. So when food enters the stomach, there's a muscle at the top, and the pH acidity is low pH. So as food enters the stomach, the pH starts to drop because that's the production of stomach acid. The signaling from that pH, in addition to the importance of stomach acid in digestion, is that pH signal closes the muscle at the top of the stomach, so and at the bottom, so that our food is captured and the stomach acid can do its work. And it cleans and chums our food properly. And as that acid reverse, as it's used up, those sphincters open up and our food, the digestion has gone a long ways. We've chewed our food, so we've really done a good job there. It's entered our stomach. Those muscles close up. Our food is chummed and cleaned, and then those muscles open, and the food then moves into our small intestine.
Not to say that you shouldn't have fluids with your meal, but you should probably drink that glass of water before your meal,
that's where,
not with your meal.
So many of the people that we work with say, I drink a little bit of apple cider vinegar in a glass of water before I eat, and my reflux is so much better, because that's acidic. So they're adding acid to their GI tract. And what do? We give them drugs that take away stomach acid.
Yeah.
And
throwing things out of whack and out of equilibrium.
Yep, which affects our whole GI mechanism, from absorption of nutrients to all sorts of bowel function problems down the road.
We're talking hygiene with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore on Super Talk 1270.
Super Talk. Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Beichel, along with Kevin Oberlander, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore. We're talking about hygiene and the different types of hygiene, how it plays into trying to stay healthy over a long, cold winter.
Yeah.
And, okay, we were just talking about eating hygiene.
Yep.
And acid reflux and all that plays into that, and big important part of keeping healthy.
Yep.
Sleep hygiene.
Let's couple more tips on eating hygiene, just real quick before we get into sleep. Eating late. If we eat late and we go to bed, our GI tract goes to sleep.
Well, and then you lay down,
so the food doesn't move through efficiently. Right. So that leads to problems.
Well, in my case, it leads to weight gain too.
Yeah, eating slowly, like we talked about. Some of the other things. Going for a walk after you eat, so your digestive system continues to work and the food moves through efficiently. Just a couple other tips that are super important.
Okay, so that's a great segue into the sleep hygiene side of stuff.
So, sleep hygiene is another question we get a lot about. You know, insomnia is a big problem in our society. I think the number one issue with insomnia is stress.
Well, and it's not always, well, I have insomnia because I'm up all night long and I can't get to sleep. The quality of sleep is, so if you're not sleeping soundly and hitting the REM cycles, then you're diagnosed as insomnia because you're not getting quality sleep.
Right. And sleep's a cycle. It's part of our circadian rhythm. People tend to think they need to treat their insomnia at night. And really, insomnia needs to be looked at as a 24-hour cycle. It's one of the first things I ask people when they talk about their sleep problems is, what do you eat for breakfast? Because our system is set up to be vital. Our adrenals put out vitality hormones, adrenalines, things that make us vital during the day. And part of that is, what are we eating in the morning? Are we nourishing our system? Do we light the fire? If we're in a log cabin and there's a stove in the cabin and we just throw newspapers in there, we might get a flash of heat, but it burns out quick. We need to throw logs on top of that so that stove gets hot throughout the day. And
a lot of people are in such a hurry. It's 3 cups of coffee in the morning and maybe a piece of toast doesn't do it.
Oh, many times the people I talk to, not only sleep, but a lot of issues I ask them about their breakfast is, well, I don't eat breakfast. And I'm like, that's problem number one, because you're not fueling your system and making it vital during the day.
So what type of fuels?
Well, I think what we lack mostly in our breakfast is protein. So in the cabin, the newspaper's carbohydrates and protein are the logs. So if we don't have adequate protein, along with our carbs in the morning, we don't get that fire burning. And if you look at the circadian rhythm, it's a surge of your daily vitality hormones, and then it gradually drops off through the day till you get to the nighttime. And then we enter what's considered the sleep cycle, where that bottoms out. We get into REM sleep until the sun comes up, and then those surge again. So it's a 24-hour cycle. So if we're not taking care of ourselves throughout the day, we probably aren't going to sleep at night.
Well, that's why they say breakfast is the most important meal of the day.
It is.
You're setting the stage. And
so if you have this big swooping curve of circadian rhythm, and we're not climbing in the morning, that tends to drop. We don't get the drop off at night. So that rhythm gets flat. And that flat rhythm is what we see with all sorts of medical problems. People don't sleep. Their immune function suffers. They're foggy. They have foggy, brain fog, because the brain the brain can't figure out the difference between morning and night because it's flat. And the sun has a lot to do with our sleep cycles. And where we live, that tends to be a problem because our days are shorter, so we don't have as much sunlight. People get depressed. That's where some of the sun lamps in exposure to lights during the day can be helpful. But the other thing
I just saw in Barrow, Alaska, I think they just hit the last week was the last day of light.
Yeah.
And now they've got like 2 months of
never gets dark.
There is no sunshine at all.
Oh, yeah. They're in that time of year.
Yeah, they're in this time of the year. It's like, okay, 60-some days of no sun.
That's pretty tough.
But people get their system and their cycle screwed up.
Yep. And some of the hardest people to help with sleep problems are shift workers, because they might work 10 days on, 10 days off, and their 10 days on is they're working at night. So their circadian rhythm is all messed up. And then they try to get back by the time they get back into a normal sleep cycle in their 10 days off, they're going back to work. So they're really
and that
difficult.
Makes you age.
Oh, it makes you age. It makes a lot of things.
It ages your body system.
Yeah, it's hard on a lot of things. Very much so.
People that work at night, that's tough enough.
Yep.
People that work on that shift work where it rotates, that's I'm surprised that they haven't figured out that that's detrimental to people's health.
Yeah, it's very detrimental. The other thing that I find disturbing is we get parents a lot of time coming in and telling us that, I have a 15-year-old that just doesn't sleep, complains all the time that he can't sleep or she can't sleep, whatever the case might be. And of course, my first question is going to be, is their face in their phone at night? Well, I'm not sure. Well, you need to find out, because if they're taking their phone to bed, they're not going to sleep, because that bright light keeps their brain awake. So, and even in the adult population, when we talk about sleep hygiene, it's getting rid of that particular light that comes off our TV and our computer for a period of time before we actually go to bed, and going to bed at the same time, and getting rid of that light, and using things, especially in the adult population, using things like melatonin or anti-stress amino acids. They can all be helpful.
Which we talked about, the reflux medications and the overuse.
Yep.
Melatonin is something that people tend to overuse as well.
They tend to overuse it, and they tend to misuse it, and they don't take it correctly. They think it's a sleeping pill, so they take it at bedtime, and it's really not. The hormone melatonin is part of our natural circadian rhythm. So we like to use small doses and stack it. Take it 3-4 times before you go to bed, so that you match the peak melatonin time during the night, because everybody's different. If we take a big dose at bedtime and we miss our natural melatonin peak at night, it's really not going to work. And people will take it for 3-4 days and say, well, I've tried melatonin, it doesn't work. You have to take it for a long, long period of time, because you have to try to get that circadian rhythm back to normal, and melatonin can be part of that. But there's other things.
a lot of different pieces with hygiene other than just washing your hands when it comes to winter health.
Exactly.
Trying to stay healthy over the winter.
Yep.
You can find a lot of these on Serenity University.
Serenity University, stop and see us. We have all sorts of tools to try to help you. We'll sit down and visit and try to figure it out.
And the lozenges for
your oral health.
Hygiene.
Can't beat them.
Can't beat them. This is Talk of the Town. I'm Steve Bach, along with Kevin Oberleiner, Dakota Pharmacy, Dakota Natural Health Center, downtown Bismarck's Corner Drugstore on Super Talk 1270.
Talk of the Town. Weekday mornings starting at 9 on Super Talk 1270 and the free Super Talk 1270 mobile app. Don't miss a Hannity Show.
I know that there is a segment of society that would love a perpetual shutdown, and I guess we could live in a bubble, but who's going to build the bubble if everybody shuts down?
Weekday afternoons starting at 2 on Super Talk 1270.
Portions of the following program are pre-recorded.
Welcome back to Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bakken, and Ann Ersley joining us. She is a physician assistant, OBGYN, with Essentia Health. And Ann, thanks for coming in this morning.
Yeah, thanks for having me.
Make sure that we let people know that you're local and not kind of by choice. Tell us a little bit about yourself. So you work for Essentia Health, but you're from Turtle Lake.
From Turtle Lake.
And I've done a lot of pheasant hunting up there in the day.
Mm-hmm. Lots of pheasants up there. I'm from Turtle Lake. I went to college at Dickinson State and then went to PA school down in Virginia.
And now you and I were talking a little bit. Part of the reason you went in Virginia is because you didn't have any plans on staying in North Dakota.
No plans of coming back. It was a joke, really, in our family, the first one to move away. And here I am, married a cowboy.
I made it out.
Yeah, but I'm back. You can't keep us out, I guess. Married a cowboy, moved back, lived the life that I did not think I would live.
So you own a horse trailer and everything, right?
We live in our horse trailer every weekend when we're going to rodeos, and I have 3 boys. Yeah.
You know, it's funny because I remember growing up in Grand Forks, and it was like, okay, everybody wanted out.
I just want to get out.
And I have traveled all over the country working, and I keep coming home. Mm-hmm. It's just like, and you're a great example. It's like, yep, I'm out. And you keep coming home because it's home. And it's just, there's no place like North Dakota.
Right.
So fast forward, now you take your PA skills back to Essentia Health here in Bismarck, and you specialize in a segment of OBGYN that actually got a lot of press during the presidential race because of infertility treatments and IVF, and a lot of that was in the news. Explain what IVF is for people and the infertility side, because it tends to be a little bit bigger issue than a lot of people think, and especially as people are waiting a little bit later in life to have families, and that's really where a lot of this treatment comes in.
Yeah, correct. That's probably the biggest cause of the increase in infertility rates, is because people are delaying their childbearing. And there are just many, I feel like we are unaware as a population of all of the things that go into achieving a pregnancy. It's really not as easy as what it seems. The rate of getting pregnant every month is 20%. So if I have 100 women trying to get pregnant each month, 20 will get pregnant, 80 will not. And I think the awareness of that would really help people maybe accept this, learn more about it, and then maybe seek treatment sooner than they do. And
biology is an amazing thing, because if one little thing is off,
correct,
the odds are not going to happen, because that's what nature does. That's how nature makes sure that we're trying to produce viable, healthy babies. And that's the nature part of that. Something can be a little askew, and nope, not this time around.
Yep. And probably 60% of issues can be fixed, and we can do so much locally before people ever get to IVF. So that's just a huge service that we can offer here in Bismarck.
So a lot of groundwork. There's a lot of things that need to go into, especially if you're in a little bit older situation. The nutrition side is huge, different supplements, lifestyle choices.
Lifestyle is huge.
What are the top factors as far as leading into infertility? So whether it's let's stick with the older right now. So somebody that's a little bit older in life, maybe they delayed because of their career, didn't get married till a little bit later, they push things off, and okay, now it's time, I want to have a baby, but I'm 40, I'm early 40s, I'm mid 40s. I know people that have gone through and 50s, they've had babies, which God bless them all, but not really the wheelhouse for a normal pregnancy.
Right. Unfortunately, as we age, especially for women, our egg quality and egg reserve, the number of eggs that we have, dramatically decreases. So your chances of naturally getting pregnant after 40 are very low, probably 5%.
And that's where you typically need a little assistance.
That is. We actually see a large number of women much earlier than that. And so at 40, we feel like we're on a time crunch. And almost always those women are getting referred to IVF or to reproductive endocrinology. From
a medical perspective, is there a hard stop or a timeline where it's probably not the best idea or not in your best interest? Or does it depend on... how's your health?
So many factors.
Yeah.
So many factors. And we always want to help the patient make the best choice for themselves. I may think at 45, your ovarian reserve is very low and your chances of success are very low. Your chances of heartache and miscarriage and things like that are higher. And of course, I like to protect people from that disappointment as well. But we want to offer them every opportunity to achieve a pregnancy that we can.
So what are some of the other factors with lack of ability to get pregnant? So we talked a little bit about the age stuff on the women's side, but there's stuff on the men's side, there's stuff on the women's side. As far as factors earlier, before you start getting the higher age, what are some of the leading factors for complicating the ability to get pregnant?
So the most common thing that we see is ovulatory dysfunction. One cause of that is polycystic ovarian syndrome, which is becoming more common as far as recognition of that. And if you don't ovulate correctly, you can't get pregnant. So that will present in irregular periods, maybe lack of periods altogether. And that's something that's very easily managed. So
we think about that a lot with athletes, female athletes that throw their cycles off because of their training and their athletic prowess, because it does throw the system off. And I'm a big believer in everything works in equilibrium, and if something's off over here because you're training for a specific, that might throw something. We see that with long distance runners quite a bit.
Yep, because they often will have no cycle at all, partly due to the fact that they have no body fat. And so we see that spectrum. And then we see obesity as a major cause of ovulatory dysfunction as well. So I think that's the most important thing to recognize is everything in moderation, lifestyle modifications, diet, smoking, vaping, excess caffeine, excess alcohol. That affects both egg and sperm quality.
So when we come back from the break, I want to talk a little bit about the guy's side, because we've just kind of covered lightly on an overview on the female side of trying to get pregnant. But there's a lot of male issues that come into play as well. We're talking with Ann Ersley. She's a PA, physician assistant, OBGYN, specializing in infertility at Essentia Health. This is Talk of the Town on Super Talk 1270.
Super Talk.
Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Baca, along with Ann Ersley. She is a physician assistant, a PA, specializing in OBGYN and infertility at Essentia Health. And we talked about the women's side, at least lightly. We'll get more into that. But what are some of the typical issues on the male side with trying to get pregnant?
So male infertility is responsible for probably 30 to 40% of issues with couples. And I would say lifestyle is the biggest contributor. So caffeine and alcohol and vaping or nicotine smoking decreases sperm count and sperm motility. And just in my 20 years of practice, have seen a significant increase in male infertility. And I think that's why.
Because we don't typically think about male infertility. We think about female infertility. But what was that number? 30 to 40%. 40%. That is such a huge number and something we don't think about.
Right. And so with our initial workups, of course, we do labs and evaluation of the female, but we absolutely always do a semen analysis because that's such a large contributing factor.
So what are some of the causes beside those?
So lifestyle certainly has a huge impact.
You didn't mention riding a horse too much.
No.
Okay.
There's no studies that back that up.
For all of our horse friends out there, the Cowboys.
You wonder.
Just making sure there.
There may be a little trauma there.
Okay. Trauma is another example, though, because, and so I went through cancer treatments, and one of the things that, hey, do you plan on having children? And my wife and I were like, well, yeah, we'd like to. So I had to go, before I started radiation, go store some sperm.
Because chemotherapy, trauma, hernia surgery,
radiation, depending on where it's at.
Other anatomical abnormalities all can affect sperm production.
So that is just a huge number to me, 30 to 40% on the male side, and you just don't think about that.
Right. So everywhere you read, there'll be this calculation. So 30% of infertility is female only, 30% male only, 30% a combo, and then 10 unexplained. So it is. So
if you're taking 100%, and then now you take 30% and 30%, it's hard to get pregnant.
It is. It's amazing that people get pregnant on their own, especially unintended.
Yeah. That is, okay, I'm learning a lot here. So when you're talking about the infertility side, because you mentioned both, when somebody's planning on starting a family, how important it is that they go see a infertility specialist or a fertility specialist to make sure that, okay, everything's normal, because you could try for a long time and not be able to start a family. And we talk a lot these days about the mental health aspect, and that can grate on a relationship huge. Yeah, I feel like it's probably one of the leading causes of divorce because it's such an emotional thing. That and finances, all right.
Yes, and men and women process things different. And it's a really difficult thing. We have a few counselors that specialize in infertility, and we refer our patients to them because it is just such an emotionally draining thing. So we say that if you have been trying for over a year and you're not pregnant, then you need to come in. There may be some very easy things that we can correct without even needing to go on with medications or inseminations or things like that. But over a year with unprotected intercourse and no pregnancy, they should come in. They should not continue to wait and try on their own. Now, if you're 35 or older, 6 months, and then they should come in because our time clock is ticking and we want to get that evaluation done sooner.
A little bit of a misconception is, so we think about the clock with females. Is there a clock with males?
There is. So for infertility rates.
Because now we're talking motility and deformation, and there's a lot of other factors
that go into that.
Yeah.
And so they say at 50, we're going to see a decrease in that sperm quality. But studies show over 40, there may be some genetic things that are showing up more. Your risk of fathering a baby with autism increases. And then as we age, we have more medical problems or gain weight. Maybe we're picking up even more bad habits. And that obviously affects sperm quality as well.
We're talking infertility with Ann Ersley, PA at Essentia Health. And the goal is to have a healthy pregnancy and a healthy baby, because a lot of these other factors, you mentioned the autism, there's a myriad of other health issues that can pop up if you're not managing that from the beginning to make sure it's a healthy pregnancy to start with. One of my questions is, over time, what have we seen? I mean, because I look at a lot of different environmental factors and lifestyles have changed from back in the 50s to the 60s to the 70s, 80s, 90s to today. Big change in lifestyle, big change in outside factors. What have we seen over time when it comes to infertility numbers?
So infertility is increasing for a number of reasons. That's probably one of them. Of course, we don't have hard studies regarding some of the plastics.
I blame a lot of stuff on preservatives.
Right,
I
the
really
preservatives, the things that are in our foods.
Processed food.
And we're eating processed foods more than we ever used to. So we just really try to encourage, let's have a wholesome, healthy lifestyle. That's good for your body in every single way, not just in regards to fertility.
So what should you tell a young couple in their 20s versus the message for a couple in their 30s versus the message for a couple in their 40s? What's the initial message that you want them to know?
So first is have a healthy body. So even if you haven't even started to try for pregnancy yet, just have a healthy body.
Starts with diet.
Starts with diet.
Diet, lifestyle.
Cook at home. Limit your caffeine to 200 milligrams a day or less. Alcohol in moderation. No smoking or vaping. Again, that affects sperm and egg quality, but also your entire well-being. Maintain a healthy weight. Weight has an impact, again, on both egg and sperm quality. Regular exercise. And then if it has been a year, if you're under 35, or 6 months, if you're over 35 and you haven't achieved a pregnancy, don't wait. Come in. Let us help you figure out what's going on.
We're talking with Ann Ersley, PA at Essentia Health. This is Talk of the Town on Super Talk 1270.
To Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bakken, along with Ann Ersley, physician assistant, PA at OBGYN at Essentia Health, focusing on infertility this morning. And, okay, you're doing everything right. You're having a healthy lifestyle, enjoying things in moderation, working out, eating properly. Nutrition is huge. And that's why, neonatal supplements are a big part of, there's a lot of foundation you have to lay. But it's not working. What are some of the signs or symptoms that there could be a problem? Because a lot of people, we don't go, especially in the upper Midwest. It's like, something's not right, but I'll tough it out. We're not going to go to the doctor. Or, again, I'm a huge proponent of the triad of care. You need to be your best advocate because you're the one that needs to. I always look at physicians as a little bit of detective work, and you need to put them on the right track to figure out what's going on with your health. So you need to be your biggest advocate. So what are some of the signs and symptoms men and women should look for that, there might be a problem, there might be an issue, there might be something going on that's going to lead into infertility if that's what you're trying to accomplish at the time. But, a lot of this comes back to some general health stuff. I mean, giving yourself exams and things like that, making sure there's no issues. What are some of the things people need to look for?
So for women, it's actually easier to have outward signs. So if you're having irregular periods or no periods at all, or you're doing ovulation predictor kits and you don't get a positive, you need to come in. You don't have to wait the whole year. You need to come in so we can see what's going on and how we can fix that.
In a lot of cases, it's something minor. And something might be just a little bit off because we talked about if everything's not lined up perfectly, you're probably not going to get pregnant. And that's just nature.
And some things are very easily fixed. I think there is a fear of they're going to come in and there's this extensive evaluation and a lot of intervention, and is not necessarily that. For men, it is harder. There's really not any outward signs that your sperm count is low. So for men, we just do that evaluation with the female evaluation right away. But if there are problems with sexual dysfunction or abnormalities of the testicles, those need to be evaluated right away.
Typically, what are the biggest issues if something is a little bit off with men and women?
So with women, it is most commonly polycystic ovarian syndrome, which is ovulation dysfunction.
Because that's a new term that I'm
in the last few years.
Okay, so the question is there a greater prevalence of that, or is it just finally now being discovered and reported better?
Yeah, good question. It probably is that we're just more aware now than we were at the beginning of my career, which I was in just family practice. People didn't talk about that. So we are recognizing it, we are diagnosing it and treating it much more frequently than we did in the past. Obesity, unfortunately, has an impact on dysfunction as well, and we are seeing a rise in our obesity rates, which is increasing infertility.
And on the male side, and I'll use me for an example, it's like, so with my cancer, I self-examined, it was testicular cancer, self-examined, it's like something was a little off, and went into my doctor, but I was able to go, okay, this is what I've got going on, and this is the road we need to go down, because things start with your primary care physician. And we were able to track down the direct, okay, that's the issue, solved, fixed, we're good. But again, people need to be able to point their physician in the right direction, because you were in family practice, and how many times did you start down one road because that was the information that was presented to you, and it was something else? Now we're leading into an infertility issue.
Yeah, and
that happens a lot.
Happens a lot, which is part of the reason we do that comprehensive evaluation when the female comes in, because men are much less willing to just go in on their own. And we have fantastic urologists here in Bismarck, and so they have been excellent at helping evaluate our men and getting them on the right track if there's any intervention that can be done to improve their sperm quality.
So somebody's having an issue, and it starts with their primary care physician, and both men and female side. Something's a little off. You go in. How do you put your doctor on the right track to make sure that, okay, if we're trying to get pregnant, if there's an infertility issue, we're going to lead to that quicker than spending time on a rabbit hole that we shouldn't be on?
Sure. I think the biggest thing is at home, you track your cycles, have some awareness of what's going on with your body, track your cycles, do ovulation predictor kits, bring that information in to any of us that work with infertility, and we can get started on the evaluation right away.
Data's king. It's like having that journal, having that information, so you go, here's what's going on, and having that well documented, because that's a real, instead of going through the process like, okay, well, for the next 3 months, track this, well, you're 3 months ahead.
Yeah, you expedite the process. You help me get an idea of what could be going on, and we just get you to your end goal quicker.
And typically for men, what's that process look like?
So we start with the semen analysis, and sometimes we just have to talk about lifestyle modifications. And so the men often come into the appointment with their wife to review that, and we will do the referral if there is a significant decrease in sperm count or motility, where we feel like there could be some anatomical things going on, or where they could benefit from medication.
So is it a good idea to come in as a couple?
It is. It's really, there's a lot of information, and so I always say 4 ears are best, and it is best for everybody to feel like they are working as a team to get to where that couple wants to be.
And a lot of that comes back to the mental health side, because the opportunity to strengthen a relationship instead of
be alienated from each other.
Because that's the thing, and it's interesting you mentioned the counselor side of that, but that's not typically something we've thought about 10 years ago in the healthcare world if you're talking about infertility.
Yeah, that's true. It's such an emotional subject, and often the female is doing everything, coming in, doing the labs, taking the medicines, doing the ultrasounds, and there's such a disconnect in the stress and the overwhelming emotional aspect for the wife than there is for the husband.
Well, and that's why that 30 to 40% number, the problems on the male side, is such a glaring number to me because, 10 years ago it was, well, it's your fault.
It's her problem.
It's her fault.
Mm-hmm.
We're not getting pregnant because it's her fault. And that was kind of the stigma around infertility at the time.
Mm-hmm.
We're talking with Ann Ersley. She's a PA, physician assistant over at Essentia Health, specializing in infertility. She focuses on OBGYN. This is Talk of the Town on Super Talk 1270.
1270.
Welcome back to Talk of the Town on Super Talk 1270.
Super Talk 1270, you're tuned to Talk of the Town. I'm Steve Bach along with Ann Ersley. She's a physician assistant, PA over at Essentia Health. OBGYN, focusing on infertility this morning. And we mentioned IVF earlier, and that's where a lot of people's minds go when you're thinking about infertility treatments. But that's kind of a little bit later in the process. There are other things, other treatments that are out there that are first steps, because the IVF tends to be more invasive, a little bit bigger process, and you may not need that level of help with fertility or infertility. What are some of the walk-up or the other treatment options that are out there?
So many easier things that we can do before you need an IVF referral. Again, the lifestyle modifications can make a huge difference in sperm quality.
Nutrition.
And no vaping.
I don't think people realize vaping, smoking, chewing tobacco, caffeine and nicotine.
Energy drinks and vaping are the demise of sperm.
Are killers.
Yes.
Absolute killers.
Yep. So we just really want to have that conversation to help people be healthier. Women with PCOS, we often start a medication called metformin, which helps improve ovulation, sometimes even helps them ovulate effectively on their own. And if that is not enough, we use a medicine called letrozole that stimulates ovulation, or stimulates the body to produce follicles, and then we can force ovulation on our time frame, so we can time either inseminations or just timed intercourse, and that has been very successful for us.
So I'm thinking it's like all of our Catholic friends out there, it's kind of the classes that they go through, they teach that as part of premarital counseling, which is good practice.
Yeah, to know what's going on with your body so you can recognize if there's a problem.
So what other treatments are out there before we get to IVF?
So we do the ovulation induction, which is medication, something called Ovidril, which triggers ovulation, and then inseminations, and we can do up to 6 cycles. And if that is not successful, then certainly people are candidates and can be referred for in vitro, or at any point if that's just the road that they want to take.
Okay, now let's move on to in vitro fertilization. For those that are not familiar with IVF, explain that to our listeners.
So that's a process where the specialist will stimulate your body to produce many eggs. They retrieve them surgically, fertilize them with your partner's sperm, and then transfer into the uterus. And
more of an invasive procedure, so that's why you want to walk up to that. Now, for somebody who one partner, it's just not going to work. What are some of the other options out there? Because there's sperm donors, there's egg donors, there's a lot of other ways to get pregnant, but you got to walk through that process as a couple.
Absolutely. And to, just come in so you are aware of the options. We do a fair amount of donor IUIs. Some partners have had vasectomies, and we have same-sex couples who just need that sperm to help complete their family. And so we work with sperm banks from all over the country, so we can give them those options.
Vasectomies. Are they reversible? Are they not? Some are, some aren't. It kind of depends, right? Because I've known people that have had it reversed because they've gotten married later and then wanted to start a family when they didn't plan on having a family, and because that was a couple's decision. What's the last word on vasectomy? There
are different facilities in the U.S. that you can go for a reversal. Will it be successful?
Don't know.
We don't know until afterwards.
Some do, some don't.
Correct.
And so a big decision for somebody, though. So what would be the advice if somebody's considering a vasectomy? Is that a time to go, okay, maybe I should store some sperm, have some sperm frozen? I know women are maybe on a career path. Women are having their eggs frozen now. Those are all things you need to think of earlier in life. Yeah,
it's sort of a conversation that is new because people didn't think like this before. But you really can say, I want to have my career and not have a baby till I'm 40. And it is best really in your 20s to get set up with...
That would be the time to be harvested and
with a facility to store both your eggs or sperm, whichever.
So is that something you guys...
We can help facilitate that.
Through that process?
Yep. We can be the people that give you all the information and get you to the right place.
So... And we talk about couples a lot, but that's a single
That's an
decision.
Individual decision.
Yeah. So if you're thinking about that, and both from a health perspective, on the male side or the female side, it's better in your 20s.
20s, yes. Your eggs and sperm are at their peak in your 20s.
And they can store those in a facility frozen forever. So a lot of information out there. If somebody wants more information, wants to reach out to your department or you specifically and get more information, how do they do that?
Well, either online or you can give us a call at Essentia Mid-Dakota Center for Women. We have multiple physicians and myself at our clinic that can get you started on the evaluation and process.
Okay, the one thing we haven't touched on is the Center for Women with Essentia. You guys are part of that with the infertility side of stuff. That is such a huge asset for our community because the focus is on women's health and all aspects of women's health.
Yes, it's a wonderful facility. It's kind of a one-stop shop. You can come in for your general medical care, your infertility questions, your menopausal care. We have lab and ultrasound and mammogram all on site. So we just can make it one place for a woman to have her complete care.
A lot going on over at Essentia Health. Once again, what's the website or how do people get a hold of you or your department?
So essentiahealth.org, or you can give us a call at the main number, 712-4000. And we, again, have multiple physicians and myself who can get you started on the process. Ann,
thanks for coming in this morning.
Thank you.
Ann Ersley, she's a physician's assistant PA over at Essentia Health, working in OBGYN, specifically in infertility. If you have any questions, feel free to reach out. And, the thing people don't think about is planning for, hey, what happens when I'm in my 40s and I want to start a family then? That's a thing you need to think about when you're in your 20s. It really is. So, and of course, all those lifestyle changes, be healthy, make good decisions, because it does pay dividends later when you want to start a family. This is Talk of the Town on Super Talk 1270.
Talk of the Town, weekday mornings starting at 9 on Super Talk 1270 and the free Super Talk 1270 mobile app.